We are the Super Tropoer Wolf Pack.
We are involved in the ACTT VII program at Stolo Nation. We have recently volunteered at the 35th Annual Elders Gathering. It was such an amazing experience, although very upsetting to look around and see so many elders with diabetes. We are here to educate communities about the prevention, symptoms, and complications of diabetes.
Have you ever taken the time to think about how many people have diabetes? Over 2 million Canadians have diabetes. Approximately 60,000 new Canadian cases are diagnosed every year. Did you know that 19.7% of First Nations adults have been diagnosed with diabetes? 1 in every 8 First Nations women report having gestational diabetes, or that diabetes is 3 to 5 times more common among First Nations than the general population. The rate of diabetes increases with age, 1 in 3 among those 55 years and older. Many First Nations children and youth are at risk of developing diabetes because they are less likely to eat and have a healthy diet. 42% of First Nations youth are either overweight or obese.
There are 3 types of diabetes. Type 1, this type occurs when the pancreas is producing too little or no insulin, and occurs when the body fails to produce insulin needed for the cells to absorb glucose. Type 2, this type occurs when the pancreas is not making enough insulin or when the body isn't using the insulin properly. 90% of people have type 2 diabetes. Type 3, this type is called gestational diabetes. It occurs during pregnancy. It goes away during the delivery of the baby, but there's still a risk of developing type 2 in the baby's life.
We had the pleasure interviewing Kelsey, Sue, and Heather from the Super Mobile Diabetes team. We asked them when we should be tested for diabetes.
If you have any symptoms that would make you think you're a diabetic. Okay, if your mom and dad are diabetic, or your mom or your dad, or your auntie or your uncle are diabetic, that's something to think about. Okay, I have an increased risk of diabetes. If you have the type of body that collects fat around the middle, that's a risk factor for diabetes. It doesn't mean that you're overweight, it just means that you have that kind of body. We call it the apple versus the pear, where you collect the fat on your bottom half instead of your top half. So apple type. And if you find yourself peeing a lot, if you're always thirsty, if you're losing weight even though you're not exercising and dieting, those are 3 symptoms we would look at and say, wow, you should really check into that and see if you're a diabetic.
The risks that may happen when you have diabetes: your heart has to work harder, your blood pressure, cholesterol, and blood sugar levels may increase. Your joints, especially your knees and ankles, are put under extra strain without an increase in muscle mass to help them. Overall, there are more stress in your organs. Your doctor will tell you which condition you're at risk of developing. With the help of your doctor, special health needs will be less likely to become obstacles to losing weight.
We interviewed Gloria Tufner, RN, for Stress-Free Health and Wellness. We asked her, what are the complications of diabetes?
People with diabetes are 80% more likely to have a heart attack or stroke and die from it than people without diabetes. So it is a high risk. People with diabetes are more likely to develop leg ulcers and foot ulcers that will cause them to lose their leg or feet and have amputations. So if you manage your diabetes well, you're not as likely to have it. People with diabetes are more likely to become blind as well. So there's a lot of complications.
Diabetes can be prevented by eating healthy and exercising on a regular basis. So we encourage you to educate others and stay healthy.